Sunrise Radio.
You're listening to Sunrise Radio with me, Kavita. Joining me now is Dr. Sarandeep Marwaha, who is a consultant cardiologist at King's College Hospital NHS Foundation Trust. But before that, she was also a CRY-funded research fellow from 2020 to 2023. Along with all of this, she's also a senior lecturer, a tutor and mentor at the prestigious MSc Sports Cardiology course at St George's University of London. And she's a true advocate of women in cardiology. Dr. Saran, welcome to the show. How are you doing today?
I'm very, very well. Thank you very, very much for inviting me to come to the show.
No, thank you so much for coming. And of course, you've been working with CRY before, which stands for Cardiac Risk in the Young. How did your involvement in the charity come about?
It was what I would say destiny. I'm a great believer in destiny, but actually it was an amazing story that as a cardiologist or trainee cardiology at the time, you often have to do research because they encourage that for you to be a good cardiologist, know your specialty well, and also it helps with job applications. And actually, I was very much saying to my bosses, I don't want to do research. That's another 4 years on top unnecessarily, unless something came about that was amazing, that really I was passionate about, because I don't like to waste time. 2 weeks later, there was a job application for Cardiac Risk in the Young for a fellow, which talked about charity. It talked about giving back to the community. It talked about research. It talked about sudden death. Everything that I had been working for or was interested in all my life. And I've been doing charity work since I was 12. So I just couldn't help myself apply for it because it was encompassing everything that I believe in.
That's amazing. And you say you've been involved with charity since you were 12, but of course you specialise in cardiology. Why did you kind of choose to go down that path, and particularly in the area of inherited heart conditions, which affect young people and also athletes and sporty individuals as well?
Mainly because I found the human body to be very, very complex, and it was fascinating. More so the way the heart works and when it's put under stress. That was fascinating. But I think as I trained and as you become skilled, you learn that the textbook side of things aren't the things that a lot of people will present with, especially young people. They can be completely fine. They can be asymptomatic. Your loved ones will think you're healthy. And then out of the blue, something devastating happens. And it's a ripple effect for your family, for your friends when that person passes away. And if you look at the subtleties of the human body, or you look at patterns, we can start seeing things or trying to prevent these diseases. And that's why I got involved with this, because actually young, healthy individuals or sporty individuals mimic people that are, or that may have disease, but mimic people that are very, very healthy. And trying to find that subtlety or trying to break that or trying to prevent someone from passing away. That I found fascinating, interesting, but also emotionally, it had implications to me because I've gone through that myself in my family.
I think that's amazing. And then you're giving back as well. And we've gone through that in our family as well.
It's hard for me as an individual hearing it. And we see this when we go round to other CRY events and CRY screenings. The families are left with this devastating kind of effect. And you can't compare this condition with cancer or strokes and things, and every condition has a devastating effect on a family. I think the problem with sudden cardiac death is people don't get a warning. It just happens. And then you're left with having to cope with these things. And that's why CRY or Cardiac Risk in the Young are amazing. And the people that work the teams that I've worked with, they are actually going out into the community. They're actually traveling, and all they're doing is encouraging people to come to an event, which is a one-day event. It takes 15 minutes of your time, essentially.
So what actually happens then at a CRY screening?
Well, it actually starts with, sad to say, a loved one might have experienced someone that's passed away. They do immense amount of fundraising, which essentially pays for a very, very discounted rate. All it is it allows someone to get free screening. So you'll get a team of us coming. A person comes in, they fill in a form. If they're under the age of 35, go through all the questions, what's wrong with them, if they've got any symptoms, if they've got any family history. So that will highlight any red flags to someone like myself. They will then go for an ECG, which stands for an electrocardiogram, which is basically, it's a way of recording your heart's rhythm. So we will print off that recording and look at the patient's heart rhythm. If we see anything that we're concerned about on the day, or if there's any abnormality or something that is rare, then we may ask that person to go and have a scan of the heart there and then on the day, which is an echocardiogram. And that looks at the structure of the heart, the muscle of the heart, because a lot of these conditions have muscle problems, which unfortunately causes sudden death or rhythm disturbances or symptoms. If that is all fine between the two of them, we will happily let the person know there and then that's it. They can go away. And then they may not need to screen for another 3 or 5 years if they're completely fine. If there's anything that we want further testing for, we will then do a letter and let the GP know, and they can get referred to their local heart specialist or come down to George's or come down to a centre that specialises in this condition, where we will then further assess them. So it's not that we're giving them a definite diagnosis on the day, it's we're preventing something, we're looking out for things, and we're essentially cushioning you or taking care of you. And if we find anything, then that instigates us saying, actually, we want to do further family screening amongst yourself, and then we will call other people.
And do you think people who haven't been personally impacted by sudden cardiac death, should they go for screenings as well? And should there be more awareness about these screenings?
Definitely. I mean, what I find is that everyone thinks it won't happen to me. Everyone thinks that they're invisible. And you, with these conditions, you may not have any symptoms. So I'm and my family know this, I always say prevention is better than cure. Cure, you can't take away the condition or the disease, but if you look out for something or you have the basic tests, and all of this is an ECG and a questionnaire, and you're seeing a cardiologist, and then maybe having further tests. It's so simple, and that might prevent heart failure, sudden death, people unfortunately having to face the consequences after. I'm so grateful for people like yourself, Sunrise Radio, supporters of CRY, our fundraisers, because actually you're promoting all of this, and it's just awareness, and that's what we need, especially in the Asian community.
Well, I was just about to ask that, actually, because apart from all the work that Sunrise Radio do along with CRY, outside of that, I haven't really heard much within the community being talked about CRY or awareness being raised. So do you think there does need to be more?
Definitely. I think, first of all, I always start at home, and I always have been trying to do health awareness, heart awareness with my family. But I find that a difficulty as well, I'll be honest with you, because, and I'm Asian myself when I say this, we don't easily go and seek help. We don't easily want to go and see a doctor. We try and avoid those. And I think we need to be aware of this as a community, because yourself, you've experienced it. I've experienced it in my family, where sudden death has happened, and everyone puts it down to a heart attack, which is actually blocked arteries. But so much can go wrong with the heart. Rhythm disturbances, that can cause sudden death. Muscle problems with the heart, that can cause sudden death, So we need to make people aware that actually people under 35 do die of heart disease. It is rare, but, there's some conditions 1 in 250 that people have, or 1 in 2,000, So it's a big range, and we're looking out for all of those conditions.
So for the average person listening, how often should they be going to get their heart checked?
For cardiac risk in the young, we screen from everyone under the age of 35, so 14 to 35. Reason being because the heart's still developing in a young child. So we can't often see the ECG changes until it's fully developed, until 14 or onwards. After the age of 35, you start developing blocked arteries, and you can't find that on an ECG. So for those tests, high blood pressure, lipids, diabetes, you need to look out for. But the people between 14 and 35, a one-off screening minimum. And then if you're fit, well, and don't have any symptoms, then you may not need to come to a CRY screening until another 3 years or 5 years. It's slightly different for competitive sports. What you'll find is that we've got an extreme end. Premier League footballers will get regular screenings. The FA, they support that. So they get that every year. So it's slightly dependent on, what's in your family history and those kind of things. So bare minimum, get it done once with cardiac risk in the young, it's free. And then you can ask us on the day what would be suitable for the next screen.
So will the lionesses have all been tested?
I'm sure they have, yes.
And of course, this year is Cry's 30th anniversary, and Sunrise Radio is honoured to be supporting Cry again during 2025. Do you have a message that you'd like to share with our listeners, particularly maybe about the importance of Cry's work and why it's become such an influential charity over the past 3 decades?
First of all, I would like to say thank you to Sunrise Radio for allowing the platform to talk about this. I'd like to say thank you to Cry for allowing me to be part of that family and continuing on. And congratulations, 30 years for a charity. It's an amazing achievement because not often a charity can last that long. And unfortunately, it came from a personal tragedy as well from their end. And then eventually that grew from bereavement or supporting bereavement families and research. The research part is crucial for Cry, and they've done so much in the last 30 years. And some of their research has gone into guidelines, and some of their research has gone into the way we treat patients as well. So they are doing amazing work. And I just want the listeners of Sunrise Radio, if you could support cardiac risk in the young, in any shape or form, or even get screening done, we would have achieved something there, especially today. So I would like to thank you all.
Thank you. And where can our listeners go to support Cry or to find out more about screenings?
So the easiest way is probably if you Google cardiac risk in the young or Cry, you will find a website that will basically show that. We are also on Instagram, Twitter, and LinkedIn, where they will give regular posts about what's happening around the country.
Amazing. And the Instagram of Facebook or X is at cry_UK. And the website there is www.c-r-y.org.uk. Thank you so much for joining us today, Dr. Saran.
Thank you very much for the opportunity for coming, and I hope this has helped with awareness for heart disease.
UK's biggest station.